Joining me now, once again, is Medical Officer of Health, Dr. Paul Roumeliotis. Thank you for joining me once again, Dr. Paul.
No problem.
All right, so first off, yesterday, Thursday, April 2nd, Cornwall's Assessment Center has opened. I'll let you give us the details.
Yes, it opened in Cornwall yesterday, and as of yesterday, I got the numbers. They saw, I think, about 30 or 35 individuals. Most of them were tested. This one works by an appointment, and the information is on our website. So we encourage people who think they have symptoms. You can go to the self-assessment page of ontario.ca/coronavirus, and you'll see there. And if you qualify and if you think you need testing, you can go to the testing center during their hours of operation. But you call them first, and they'll give you an appointment. That way, is less people waiting in line. So it's a more effective way of physically distancing people.
Absolutely, and on the note of physical distancing, we've got some projections from the Ontario government earlier today, and the health unit is responding accordingly with some new orders. So I'll let you address that to our viewers.
Yes, we've been saying all along that the more we physically distance ourselves, the more we take these public health measures, the better it will be to decrease the number of cases. And today there was an announcement that if we hadn't done anything in Ontario at all, there would have been close to 100,000 deaths, which is horrible. But the good news is that with what we're doing, we're really bringing that number down, and people can just do the math with our area. We're talking in our area. Initially, they were saying, our projections were up to 300,000 people getting infected. That means like 4,500 people in our area, because I was doing the math, a calculation, and by some of the things that we've done so far, we brought that number down from 300,000 to literally 80,000, and in our area, like 3,000 cases were prevented, 3,300 cases prevented. So those are important numbers, and so now, with the current scenario, we've really brought them down, but we can bring them down even further. And this is just between now and April 2020. And so I'm sort of looking at my notes now, because we just came off the press. So also looking at deaths, I'll give you an example. This is a stark reminder. We know that this virus can kill people, predominantly the elderly. And so if you look at some of the numbers, they projected just until, I'm talking the next couple of weeks, till April 30th, the projection was if we hadn't done anything, and I want to stress to people, this is if we hadn't done what we're doing so far, there would have been close to 6,000 deaths in Ontario, and that translates to about 90 deaths in our area, and that's presuming everybody is healthy. We have a higher rate of vulnerable individuals, so it could have been even higher in our area. And by just what we've done now, we've prevented across Ontario 4,400 deaths, and in our area we prevented at least 66 deaths. And so currently, in terms of the number of deaths, we're looking at 1,600 projected dates as of today for the next month, if we continue what we're doing right now. That's about 24 deaths in our area. Again, it's 24 too many. And then if you look at, if we further extend our interventions, and we'll talk a bit about that later, but if we further extend our social isolation, ensure that people self-isolate, and ensure that people who have the disease don't go outside, ensure that travelers stay home, and all these things, we could bring it down from the tragic 6,000 number, or 90 in our area, to a couple of hundred, 200 in all of Ontario. Again, 200 too many, but unfortunately this is what these viruses do. And in our area, it will bring it down to 2 or 3 deaths. Again, 2 or 3 deaths too many. But we're facing a situation where this virus, there's no vaccine. Unfortunately, there's no effective medication. So the best we can do is to work together. And this is why it's important. You can see how these numbers are important, because now people put a value to, oh my God, yeah, I'm socially isolating, my kids are home, everything's closed down. Why are we doing this? We're doing this because of the numbers. If you hadn't done it, in our area, we would have had at least 40, 50 deaths. So far, we've cut that down significantly, but we want to cut it down even more. And that's why we're going to be doing some more extending measures, being more serious about enforcing some of the orders and some of the directives that we've given.
All right, so let's move on to some of these new orders that have been just announced.
Sure. Well, one of the things that has been, we've got a lot of complaints all across our territory, predominantly in the Cornwall area, that a lot of the retailers and some of the shopping malls, people go into the store, they run around, kids run around, and they're congregating. They're not really respecting the physical distancing, and that's not good. We need to have both the public know what the shopping etiquette is, and we have a whole section on that on our website in terms of making sure you go one at a time. Don't take the whole family to shop, and go only when you need when it's necessary. Follow the infection prevention tips. A lot of the stores, on the other hand, are great. They're telling people, you come inside, wash your hands one at a time. If you're waiting outside, you socially distance yourselves. But we still have complaints for a couple of area stores that individuals are, they're not heeding the advice, or the stores are not really implementing those measures. So I'm going to issue an order. Actually, the order has been issued, but one of the things that we wanted to do is, with an order to all retail, all operators, all malls, everybody who's still open, that they must follow certain directives in order for them to ensure that the people who go into the stores and their employees are as safe as possible and do not propagate or spread the virus. So that includes crowd control, that includes disinfection, that includes having people, making sure that people don't congregate in the mall, in the parking lot area or outside of the store. So those are very simple things, but people are not following them. So now there'll be penalties associated with those things. That's one thing. The other thing we're going to be doing is I've issued what's called a Section 22 order, a class order, to anybody that is tested positive for COVID, or have been in contact with somebody who has COVID, or, for example, has symptoms of COVID, even if they haven't been tested, and because more and more people may have symptoms and we're not sure. But so if you're not sure, so if you fall into any of those categories, or we've told you, the health unit, to stay home for 14 days. If you break that, again, there's going to be an order that, again, there will be fines and enforcement abilities for us to do that. We're working with our partners, both in bylaw and our police officers as well, plus our own provincial offense officers, we're taking this seriously. So I know it sounds harsh, but it's harsher to say we've got deaths that we can prevent and we didn't do anything about preventing them. So now's the time that we need to extend those measures, and perhaps in the next couple of days there'll be some more provincial ones in terms of the number of people that can gather. We can maybe even limit that and say no more than 2 people. But for now, we want people to understand that when they should leave the house only for essential purposes, go one at a time to grocery shopping or pharmacies. And we are also going to be, again, compelling those retailers or those stores that are still open to ensure they take the necessary precautions to protect themselves, their clients, the people that are walking in, as well as their staff. And at the same time, we're actually, giving directives to the public to, again, heed their signs. Make sure you follow. Some of the stores have markers in terms of how much to distance themselves. Follow those instructions, please.
And on that note, one of the most frequently asked questions that we're seeing all over is people wondering how they can maybe report people that are not abiding by these orders. So what is your advice for that?
These orders can be enforced either by our public health officers or our enforcement officers at the health unit, and any municipality, the city of Cornwall, the police. So you can call any of those three. We're working together to make sure that we enforce them. Either one of us will go there, depending on where the call is. And don't forget, we have a bigger area than just the Cornwall area. We have Prescott Russell and the others. So we're working with all our municipalities, and we do have a duty desk that will take in those complaints, and then if necessary, we'll work with the police. I'm on constant communication with our police force here in Cornwall. Chief Aikman and I speak virtually regularly. And so there are mechanisms in place for us to make sure that people take this very seriously. This is not a time to say, well, it's not here, I don't have it, or I don't believe I'm going to get it. No, it's time to say, even if you may not suffer a lot from it, think of those numbers that we talked about. Think of those numbers that, if we hadn't done anything, we would have had close to 100 deaths just in our area. We're preventing a lot of those, and let's bring it down. Like I said, with what we're doing now, we're looking at 25, 30 deaths, if not more, in our area, because people are vulnerable and we have higher rates of the elderly. Well, I want to bring it down. I want to bring it to zero. Unfortunately, we might get some deaths like we did in H1N1, but at least let's keep it to a minimum. So essentially, by doing these, by heeding to our advice, by staying home, staying safe, you're actually saving lives.
And finally, Doctor, one of the numbers that really jumped off the page from the province's report was that this could last 18 months to 2 years. Let's finish off with just your thoughts on that projection.
Yes. Unfortunately, there's no real way that I can predict how long it's going to last. The problem is that because a lot of people are not immune to this, it could last for a while. However, the good news is that as more people get infected and most people will recover from it, there will be what's called herd immunity. So the virus will have less chance to propagate itself. So that doesn't mean we're going to lock down everything for the next 18 months. That's going to mean we're going to be paying attention. And hopefully during that time between now and then, we'll have a vaccine that will help us even more stop this virus.
And on that note, Dr. Paul, I'd like to thank you once again for joining me and updating our viewers. And thank you once again.
No problem.